Colorectal cancer are cancers that can develop either in the large intestine, which goes down into the rectum and then down to the anus. A lot of these cancers are silent. You don't always have symptoms from these types of tumors, and they can grow very slowly over a period of months to often 5 or 10 years.
What the data shows is that for patients with rectal cancers, surgery alone is not sufficient, and typically you have to add radiation and chemotherapy to sterilize any microscopic cancer cells that may be left.
Often we can give radiation therapy and chemotherapy before the surgery to shrink the size of the cancer so that the surgeons can perform a smaller surgery, an easier surgery, and preserve the anal sphincter. And what that really means for the patient is instead of having to wear a bag for the rest of their lives, they can have a surgery where just the diseased part of the colon or the diseased part of the rectum is removed, and they can continue to control their bowel movements.
Patients that see me usually have the diagnosis of rectal cancer, so they've already had a colonoscopy and have had biopsies to determine that they have colorectal cancer. My purpose is to evaluate them, stage them. Staging for colorectal cancer typically involves doing CAT scans of the chest, abdomen, and pelvis. So all these tests are used in combination to determine, one, if the treatment is appropriate, and two, to guide us in what we need to treat and target.
We then put together a plan for the patient and present to the patient based on their particular medical issues, based upon their particular cancer and type of cancer. We customize the treatment.
Oh, it looks like you've covered all the area. It looks good. This is a good scan, good quality.
External beam radiation therapy is radiation delivered from outside in through a machine called a linear accelerator. The patient lays still on the table while the gantry rotates around and delivers radiation from different angles. Right now, we're more precise in the way we deliver the radiation. We're able to spare normal tissues the effects of radiation. So particularly rectal cancer patients, you have critical structures like the bladder, the rectum, and bone.
We can deliver higher doses of radiation more safely, more precisely, which means a higher chance of cure and a smaller chance of developing side effects. So there's been a real renaissance in the field of radiation oncology. The typical side effects would include some mild fatigue, some slightly loose stools, which they may or may not be having already as a result of their rectal cancer, maybe a slight skin reaction or dryness of the skin, but it's in general very well tolerated.
The outcomes for colorectal cancer continue to get better and better. Cancer patients come in with a lot of questions, a lot of anxiety, a lot of concerns about how their treatment will go, what will happen during their treatment, how their care will be coordinated, and we do a very good job in our company in making sure we make people comfortable. We've got support staff in all the centers. There's the radiation therapists who work with the patients delivering the treatment. We've got very highly trained people. We've got medical dosimetrists who work with the physicians in planning out each patient's treatment.
Our company is state-of-the-art in terms of treatment delivery and have the most compassionate physicians nationwide. And I think both are important in determining where you feel comfortable getting treatment.